We also may ask ourselves, why do victims stay in abusive relationships? Domestic violence affects everyone, and it's our collective responsibility to address and prevent it. There are more people that are for you and advocating for you and need you in this world than the one person that may be against you. There is no shame or guilt, just freedom.
Statistically speaking, most people have or know someone who's been affected by domestic violence. Sadly, way too many miss the warning signs until it is too late. Today's episode, we focus on intimate partner violence with trauma expert Dr. Tamala Black. Thank you for watching, and don't forget to do what? Click subscribe.
October is Domestic Violence Awareness Month. I'm Dr. Tamala Black, professional psychologist and licensed and marriage family therapist. And we'll spend some time today exploring the differences and the overlap between domestic violence as well as intimate partner violence. We'll also cover a bit about forms of abuse, warning signs, why victims stay, and also how to help yourself or a loved one that may be experiencing these circumstances. So, when we think about domestic violence, it's actually a pattern of abusive behavior in any relationship that is used by one partner or person to gain or maintain control over another intimate partner or person. And the National Institute of Justice defines IPV, you'll hear me reference IPV, intimate partner violence, throughout this segment, as physical, sexual, or psychological harm inflicted by an individual or a partner or a spouse. IPV, also sometimes called domestic violence, can occur in various forms, including physical, verbal, emotional, psychological, economic, and sexual abuse. And survivors of IPV can experience both immediate and long term health, social, psychological, and economic consequences. The complexity of IPV experience can affect persons across many different domains, including individual, interpersonal, familial, community, societal. Both IPV and domestic violence refer to physical, sexual, psychological, or stalking behaviors towards partners in a relationship. However, domestic violence can also encompass abuse towards children and elderly persons within families. IPV specifically actually really highlights the intimacy of intimate partner violence. It occurs across gender, race, ethnicity, economic, geographical, religious, and disability lines. Globally, up to 70% of women experience some form of gender based violence in their lifetime. And in the US, nearly 1 in 4 women reports experiencing violence by a current or former spouse or partner. Approximately 1 in 10 men in the US experience sexual violence, physical violence, and or stalking by an intimate partner during their lifetime, and reports some form of intimate partner violence as well. We will consider some forms of abuse. Now, when we think about abuse, it's not just physical, but it's psychological and emotional as well. When we consider forms of abuse, some psychological and sociological theorists differentiate between expressive and instrumental domestic abuse. Expressive abuse is less deliberate and results from difficulty in managing emotions. Instrumental abuse is more deliberate, it's intentional, and it's purposeful, and it's an attempt to use violence as a mean of control. Expressive abuse is more amenable to psychological treatment than instrumental abuse. But if left untreated, expressive abuse does evolve and typically becomes instrumental over time. DV is also a form of bullying. And according to the National Institute of Child and Health and Human Development, victims of bullies are themselves at risk of becoming violent, suffer from depression, anger, low self-esteem, and also create these enactments within their adult relationship. So, as we transition, some types of abuse are number one, physical abuse, and we find hitting, slapping, shoving, grabbing, pinching, biting, hair pulling, etc. Sexual abuse is coercion and attempting to coerce any sexual act without consent. Emotional abuse is undermining an individual's sense of self worth through constant criticism, gaslighting, belittling, etc. And then we have economic abuse, which is an attempt to actually make your partner or persons financially dependent or have complete control over their financial circumstances. Psychological abuse, which means causing fear by intimidation, threatening physical harm to self, partner, children, or even partners, parents, family, or friends. And then we have and highlight that perpetrators of IPV may also have a history of childhood abuse, a history of high conflict interpersonal relationships, and also projects traumatic enactments into a current relationship and feelings of powerlessness and feelings of being ineffective within themselves or the world. And then we're actually trying to understand what can we actually watch out for? What are some warning signs? So some potential warning signs of those who abuse their partners are extreme jealousy, possessiveness, unpredictability, explosive temper, isolation from others and shaming when the partner has other social connections, cruelty to animals, verbal abuse, questioning or minimizing your needs, sudden or swift mood changes, controlling behavior, rigid belief systems about the roles of men and women in relationships, forced sex, or disregard of the partner's unwillingness to have sex, sabotage of birth control methods, victim blaming, threats of exploitation, digital shaming and harassment, devaluation, envy and jealousy, sabotage or obstruction of the victim's ability to work or attend school, control over finances. Also, we see abuse of other family members, including children or pets. We also identify accusations of extramarital affairs or flirting, cheating, manipulation, demeaning the partner either privately or publicly, embarrassment or humiliation of the partner in front of others, and harassment. Now, it may seem like a long list, and you could certainly rewind and go back and jot down some notes and really do an analysis of whether you're in a healthy relationship or not. And I would also like to actually highlight and include individual factors, which includes biological and personal history that increases the likelihood of IPV, victimization, or perpetration. And we see this in younger ages, lower educational levels, witnessing or experiencing physical or sexual violence in childhood, use of alcohol or drugs, presence of untreated personality disorders, perceived acceptance of violence, history of abusing partners. Relationship factors includes aspects of personal relationships that increase the risk of being a perpetrator or a victim of IPV. These relationships include family, friends, peers, and romantic partners, such as conflict or discontent in a relationship, family male dominance, and this can be shaped by cultural or societal norms, economic strain, financial decrease, having multiple partners, or even disparity in educational levels between partners. So, some consequences of domestic abuse in any form and IPV include harm to an individual's physical health, mental health, emotional, financial, and sexual, and even reproductive health. Additionally, consequences to IPV survivors can include physical and emotional injuries. Sustained injuries by a partner's abuse can heal fully, partially, and sadly, sometimes not at all. Some injuries are difficult to identify or associate with IPV, such as gastrointestinal symptoms, fibromyalgia, chronic pain, or worsening of asthma, just to name a few. Death is by far the most severe and negative consequence of IPV. IPV increases the risk that a partner may commit suicide or even die at the hands of their abuser. Survivors of IPV often suffer from high levels of depression, anxiety, paranoia, and phobias, while both men and women experience negative mental health outcomes. As a result of partner violence, the consequence for women can be greater, especially if the abuse includes severe physical violence. In addition, women who are exposed to violence for longer periods of time can often suffer from severe, long lasting psychological consequences, such as severe emotional distress, cognitive difficulty with learning and remembering, PTSD, even thoughts of suicide can be a consequence. We also may ask ourselves, why do victims stay in abusive relationships? So, one of the reasons why victims may stay in an unhealthy or abusive relationship is because of fear. Fear of the abuser, fear of losing custody of children, fear of societal judgment, financial dependence, lack of financial resources to live independently and even begin again, emotional attachment. This is the love of their life, seemingly, and attached to their abuser, hoping that the abuser will change or they themselves would be able to actually change the abuser. Also, familiarity with aggressive relational attachments beginning in childhood. And then we have isolation, lack of support from family and friends. We also find a psychological bind in really understanding the psychology behind a victim. And what we find in persons that actually stay into negative or abusive dynamics, it's their belief system, how they see themselves, their self-concept, how they themselves were actually treated by caregivers, parents, previous partners that actually shaped their sense of deserving, self-worth, and also their ability to actually assert and establish boundaries. So there is a multi-factor process that is happening both internally that actually ties to belief systems, but also externally, such as economic um, difficulty or dependency. We're going to actually transition to how do we help? This is a lot of information. It seems to be more prevalent in society now more than ever. So, first, we listen without judgment. We offer emotional support. We actually educate ourselves and provide information about local shelters, hotlines, and support groups. We encourage them to actually seek professional help and create a safety plan. A safety plan is an interactive process that can be done over a period of time, usually with a professional. The components of a safety plan should include general and specific strategies for promoting safety and preparing for escape or separation. It empowers a person to actually have a sense of agency and autonomy over their life. The initial steps of safety planning often involves a therapist or a counselor that will provide and guide the person the appropriate steps to prepare and enact a ready to go safety plan. And some of those tips may involve, such as keeping cash or a copy of keys secured and readily available, having supplies for self and children readily available as well, making arrangements for care of pets if you have them, removing weapons from the home, as well as sharp objects, discussing the safety plan with family members or a friend, having a safe location to actually meet, strengthening the home security, such as changing locks, installing security cameras or systems, creating an escape plan, asking neighbors to call the police if they hear or they're aware of a violent event, have a code word or a sign for neighbors or friends to alert them when help is needed, identify safe rooms in the home to escape from the violence, identify and address needs for transportation and communication, create a plan for even workplace safety, identifying strategies needed to increase the safety for children, and most importantly, above all, it is more of a preventative approach to understand what to look for so when you first see the signs to remove yourself before it escalates. As we actually observe and continue to actually create space for this important and relevant topic of domestic violence, it is meant to raise awareness, to take the shame and the blame out of the experience, to support victims without judging or blaming, and provide resources. Domestic violence affects everyone, and it's our collective responsibility to address and prevent it, not only for the victim, but also for a chance for the perpetrator to actually rehabilitate it as well. This is accomplished through education, knowledge of healthy relationship dynamics, self accountability, gender equality, respect, empathy. Intervention strategies such as counseling and support services can also be helpful for individuals who are experiencing or perpetrating domestic violence. I'll leave this with you. If you or someone you know is experiencing domestic violence, please don't hesitate to call the National Domestic Violence Hotline at 800-799-SAFE. The National Domestic Violence Hotline is available to call 24 hours a day, 7 days a week, or online at www.thehotline.org. It isn't just for those in crisis, but you can also call to get resources, information about domestic violence, or just if you want to talk to someone, if you're questioning if this is an unhealthy dynamic or not. You don't have to be pulled into a cycle or make yourself tougher or complacent or stronger in order to emotionally survive an impossible and abusive dynamic. Stay safe, love and value yourself, and always remember that asking for help is vulnerable, but it's actually a strength. There are more people that are for you and advocating for you and need you in this world than the one person that may be against you. Remember and learn to know who you are and your worth. There is no shame or guilt, just freedom. And with that, I will say, be well.